We met and interviewed with vendors from all across the country. And the one that stood out for us was Ultrasonix. They were clearly designed for the end user. It's a tremendous amount of thought that's been put into the process. Everything is where it should be, whether you're an advanced user or someone who's relatively new to ultrasonography. As an example, the touch is excellent for everyday clinical use. It's something that can be just picked up and used right away. We have an ultrasound tech who works on staff, and she demands a little bit more variety in terms of feature, and that's why the MDP is your more full-featured system for a more traditional radiologist or ultrasound technologist. What we're seeing more and more is that the residents, the students, even general gynecologists who've never used ultrasound before are finding ways to incorporate it into their clinical practice. It's gotten to the point where it's a routine part of the physical exam in many circumstances. And you know, the fidelity of the images is so crisp now that you don't need to be an expert in order to interpret them. When people come in and do a preceptorship, the first thing that we do is show them the advantages of clinical ultrasonography. In this day and age, I don't understand why a busy gynecologist or a busy reproductive health specialist wouldn't have an ultrasound in their office. And you know, not one of those little laptop-based that have a grainy image on them. If you're going to do your job, you need the appropriate equipment. And you know, when people find out how relatively inexpensive it is to have a high-fidelity ultrasound right in your office, it makes a lot of sense right away. Here in an office setting, we do about 20 sonohistograms a day. And we're seeing just a tremendous amount of pathology that allows us to target treatment such that, you know, we know exactly what we're dealing with right from the first day that we meet the patient. So one of the selling points of our clinic is you feel better faster because we get you from point A to point B in a fraction of the time. We are doing office surgical procedures right here in the office, and we're doing them under ultrasound guidance. Things that were typically done blind in the past, so we have the advantage of the watchful eye of the ultrasound to make sure that we're putting things where they ought to be. If you don't look, you won't find. And the amount of pathology that we're discovering by using techniques like pelvic ultrasonography and saline sonohysterography is astounding, and it's far more than people would have thought. And once we publish our data, we feel that people are going to see that it's the ideal approach to outpatient treatment.